Hello everyone, I'm here. Today we're going to talk about the relationship between poor oral hygiene and an increased risk of cancer. When we think of poor oral hygiene, we often think of cavities, gum inflammation, and mouth ulcers. But did you know that it can also raise your risk of developing tumors? That's right, several types of cancer have been linked to poor oral hygiene. So if you want to keep yourself healthy, it's important to take care of your teeth and gums. But how does poor oral hygiene lead to cancer? Let's take a look at 5 reasons. 1. Inflammation. According to research published in the Journal of Clinical Periodontology, people with gum disease caused by poor oral hygiene are at higher risk of developing cancers in the mouth, stomach, and esophagus. Poor oral hygiene promotes the growth of harmful oral bacteria. These bacteria can then enter the bloodstream and trigger inflammation throughout the body. Chronic inflammation has been shown to promote the development of cancer. 2. Toxins. Another study published in the same journal found that oral bacteria can release toxic compounds that damage cellular DNA and impair the body's natural ability to repair cells. This can lead to the development of malignant tumors. The study also showed that people who do and practice good oral hygiene often suffer from microbial imbalances in their mouths. This allows harmful bacteria like Streptococcus mutans and Lactobacillus acidophilus to flourish. These bacteria increase the risk of oral squamous cell carcinoma, the most common type of mouth cancer. 3. Tooth decay. Tooth decay also raises the risk of cancer, especially when it's present alongside other oral infections and inflammation. A study published in the International Journal of Cancer found that people with a history of tooth decay were at higher risk of developing cancers in the oral cavity, pharynx, and larynx. 4. Tooth loss. Neglecting dental hygiene can lead to tooth loss. And according to research published in the Journal of Dental Research, losing 5 or more teeth significantly increases the risk of developing cancers in the mouth, throat, and larynx. 5. Mouth ulcers. Poor oral hygiene can also increase the risk of mouth ulcers, which can be caused by a variety of factors, including stress, nutritional deficiencies, and certain medications. And here's why this is a problem. Certain viruses can use mouth ulcers as a gateway to invade the body. For example, the human papillomavirus, or HPV, which is commonly transmitted through sexual intercourse, can cause mouth ulcers that lead to oral cancer. In fact, HPV is responsible for about 70% of oral cancers worldwide, and that's not all. A study published in the Journal of Clinical Oncology found that people who had both poor oral hygiene and HPV infection were 5 times more likely to develop oral cancer than those who had neither. Other types of ulcers, such as those caused by herpes simplex virus, have also been linked to an increased risk of oral cancer. It's important to note that poor oral hygiene increases the risk of these cancers up to 5-fold. When combined with alcohol consumption, the risk becomes even greater. The same applies to smoking, as tobacco users suffer greater harm when they also neglect oral care. I hope you found this video informative. If so, please feel free to share it with your friends and family. Until next time, stay healthy and keep smiling.